next presentation is Medical Students' Perception on Assessment Program in the new Doctor of Medicine curriculum from Ms. Supitcha Anuwongworavet.
Hello, my name is Supitcha Anuwongworavet, and today I will present my research on medical students' perception on assessment program in the new Doctor of Medicine MD curriculum. So first of all, we have to define what formative assessment is. Formative assessment, or FA, is an assessment tool that holistically evaluates the weaknesses and areas of improvements for both students and professors. Formative assessment has been shown to improve student performance by enhancing their motivation and self-management skills. Ultimately, formative assessment boosts student engagement and increases the effectiveness of learning. At Supitcha College of Medicine, or PSCM, which is a new Doctor of Medicine program established in 2020, there is an emphasis on formative assessment. At PSCM, formative assessment is taken intermittently at various stages throughout the year, as in-course and end-of-module formative assessment. And there are two formats of assessment, which are OSCAPI, or Objective Structured Clinical and Practical Examination, which is similar to the OSCE, and SBA, or Single Best Answer Questions. Summative assessment, or SA, on the other hand, is performed once at the end of the year. There will also be an end-of-year formative assessment to prepare students. The objective of this study is to explore medical students' perceptions and concerns about formative assessment and summative assessment. For methodology, the design of the study is a cross-sectional survey where the questionnaire was sent online to participants. The inclusion criteria is second and third year PSCM medical students who had experience taking both FA and SA. So there are a total of 92 PSM medical students. However, the first year students were excluded because they have not done SA. So this left us with 59 second and third year medical students. The online questionnaire itself was adapted from a study from Lim et al., and it was approved from Julapon Royal Academy Ethics Committee and was also validated by 4 medical experts prior to sending the questionnaire to students. So the questionnaire is composed of 5 parts, excluding the informed consent, where Section 1 will obtain demographic data, and Section 2 is students' perception of FA, or SPFA, which consists of 17 question set using 5 rating scale. This section will look at 5 aspects, including congruence, authenticity, consultation, transparency, and accommodation characteristics to better understand students' perception of FA. Section 3 will look at students' preference concerning FA, consisting of 11 questions and 5 rating scale. The last 2 sections, Section 4 and 5, will be open-ended questions, where Section 4 will look at FA, and Section 5 will look at SA. For the results, a total of 40 participants responded, which gave a response rate of 67%. And the academic year of 57.5% were from the third year of medical school, and approximately 68% were female. Over 80% were 18 to 20 years old. For SPFA's results, this indicates an overall positive perception of FA in all of the 5 subscales, as illustrated by the last column in yellow. And there were no statistically significant differences in the age, gender, and academic year. For students' preferences of FA, out of the 11 questions, 8 questions showed an overall positive responses regarding the students' preference for FA. When referring to positive responses, this means that the students are in favor of FA, and this correlates with the answer from the open-ended section. For instance, one student said, "The use of FA improves my performance and learning." As for the other 3 out of the 11 questions, there were mixed responses. For mixed responses, this means that a relatively high number of students chose 3 on the scale, which is the neutral answer, while 1 refers to strong disagreement to the statement or the question, and 5 refers to strong agreement. So if we take a closer look at question 4, the use of FA stresses me, it is seen that around 37.5% of the students are more lean towards thinking that FA stresses them out, and this actually is supported by the answer from the open-ended question section 4, where, for instance, one of the students said that FA stresses me out when I get a low score. For the effects of SA on learning, 80% of the respondents feel that the end-of-year summative examination also enhances their learning by improving their study strategies as well as their self-evaluation. And the quote below is an example response from one of the students. For discussion, the study explores students' perception in the new formative assessment-based MD curriculum, where 80% of the participants agree that FA actively enhanced their learning and also aid in self-assessment as well as identify areas of improvement. 80% of the participants also agree that FA helped them prepare for the end-of-year summative assessment. As for the possible negative effects of FA, students said that FA can at times be stressful and time-consuming, and some negative emotions can also arise when they receive feedback on areas that they need to improve upon. As for improvements for FA, participants proposed that medical students should be involved in designing the FA, and this will also enhance the flexibility of FA schedule and address any negative effects of FA that could result in students being stressful or thinking that it's time-consuming. And additionally, the feedback process efficiency should also be improved. As for limitations of this study, this is a single institute study with a relatively small sample size, and there was also no diversity in the formats of FA because there are only OSCP and SBA, so it might not be generalizable to other institutions. So in conclusion, although FA could significantly improve students' academic achievements, most positively perceiving FA can also create additional stress and can be seen as being time-consuming. And end-of-year SA can enhance student learning and encourage improvement of study strategies. And for further improvement, student participation in the implementation of FA and SA could be employed. Thank you.
Shall we hear a question from on-site session first?
Sorry. Thank you very much. That was a really interesting presentation, and I'm a big fan of incorporating formative assessment into the curriculum to support summative in the end. I was wondering whether, with the formative assessment that has been included, is the formative assessment compulsory or voluntary for students? Do they have to take it?
The formative assessment is compulsory for students, so all students need to take it for both OSCP and SBA formative assessment. Thank you.
Excuse me. From your result, you found that FA is stressful, time-consuming, and create a negative emotions. But from your role, what are you going to do with this result?
So although there are some negative aspects of FA, the percentage is relatively low compared to the positive aspects. We found that over 80% has positive response and are in favor of FA. However, for the negative aspects, this is at around 37.5 or 12.5%. And so what we can do about this is to take the students' feedback on how they could be involved in the process of planning or designing the FA to address any issues or aspects of the FA that causes stress or negative emotion to better improve their experience of taking FA. Thank you.
Thank you for your interesting study. I have two questions which is consecutively linked. The first, are there any correlation between the results of the FA and the SA? And the second question is, can you explore the students' attitude about FA, like how they can improve their FA result or use the FA result to improve their academic performance in the SA?
So we did look at, it's actually in the further study to compare the results in FA and SA to see whether the performance in FA actually correlates with the performance in SA or whether they learn from their mistakes in FA to enhance SA. So this is actually a further study that could be done. And for the second question, that's about, what was the question? Could you repeat? Sorry.
like I think if the students can use their FA result to improve or maybe adapt to their academic performance on the SA.
Okay, so we actually had an open-ended answer section for this, where they gave answers about how what they learned from FA can benefit from SA, and we can use that information to also talk to individual students and see how and whether they.
Thank you for your interesting presentation.